introduction and objectives. And the question is, were you able to get your readers into your line of thoughts by the logic and flow of your introduction? Remember, I said your introduction must provide a premise upon which this study is going to be done. So any reader reading your introduction should be able to follow your thought process, knowing where you are going to. So when you look at this again, say, did this actually achieve the aim? Then you look at, why am I doing this study? What was their motivation? You can say whatever I like, but you ask yourself that question. Was the justification convincing? Was somebody reading it from New York say, oh, this study was necessary? Is it a Leica syndrome? I told you yesterday, avoid this Leica syndrome. It does not appeal to anybody outside your territory. So you look at your justification again. You look at your research questions. Did the research question actually bring out the question you want to ask? Remember, you're the one asking yourself this question. This question I want to ask, is it really well crafted? Will people understand the question? And of course, your hypothesis, were they clearly stated? If it's a null hypothesis, was it actually null hypothesis? If it's a inferiority, non-inferiority, superiority, is it well crafted to adapt to the study design? Is this something that can be tested? And then you get down to your objectives. Questions you must ask yourself every time you state your objectives. Are they specific? Are they measurable? Are they achievable, relevant, and time-bound? All your specific objectives must have these parameters. They must have these characteristics to what it sorts. Next, literature review. You are looking at your literature again. See, was there an in-depth search of local and international literature? Do you just go to Google, type in what they're saying, some articles just came up and that's it? Or you got one other study that had been done and you copied everything, secondary references, tertiary references, and put that? No, you have to ask yourself, have you actually searched literature? For me, search of literature takes about 50% of the time you have for all your research, because it takes time for you to actually have an in-depth search of literature, making sure that everything published in that topic, you've uncovered it, and then know whether you want to review them or not. So that's the question. Did you use the keywords and phrases that can bring out what you want, linking them with these Boolean operators? Because you must use Boolean operators to help you refine your search. These articles, are their current articles. Like you can't be writing in 2024 and your last article was 2000 or even 2010. Oftentimes, limit your search to the last 10 years or 15 years, except you're talking about marquee publications, landmark publications that you can do without, you cannot do without. But oftentimes, limit your search to 10 years, 15 years. And then the ones you are actually reviewing, the one you actually review, did you actually have a good exclusion criteria or inclusion criteria? Are the population similar, the intervention similar, the comparison group similar, and the outcome similar, as well as the study design reports? That's the PICOS model. For any article you want to review, you want to say, oh, the population in this article, is it something as mine? I can't be researching for headache in children, and I'll download all the articles of headache in adults. They're not the same population. I can't be looking at how ibuprofen helps headache, but I go and download articles on how hydralazine helps headache. So you must make sure the population, the comparison, the intervention, the outcome are the same, because you are focused on your title. And then, was each article critically appraised? And this is where most of us get it wrong. Most of us don't critically appraise that. What I see often that they summarize the article for you in 10 lines. That's not critical appraisal. Each literature you have must be critically appraised so that you understand what they actually did, why they did it, the outcome. And it's only in that way that you can interpret their results, knowing their particular circumstances. Finally, were there any gaps identified? Some will finish literature after and say, this study have not been done in my center, meaning that you didn't identify any gap. And therefore, that study will have no justification. You look at your methodology again, look at your research design. Yes, you might have chosen case control study, but you have to actually convince yourself that case control study is the most appropriate study design. Good. Then, are there other study design that could have been used? You can say, oh, I could have done a cohort, I could have done an RCT. So you must have justification where you choose the particular research design as against the others. You must have that. You must convince yourself that you have good reasons to have chosen this against the others. Your sampling technique. Did you do it the normal way? Oftentimes we encourage random sampling. Yesterday I say run away from convenient sampling because it says nothing. Sample size must be adequate. Controlling or making room for attrition. You must make sure you use the correct sample size, because one bad thing about research is that if your sample size should be 100 and you use 99, that result is rendered invalid. So you must make sure you use the correct sample size. And when we are reviewing, these are the things we are looking at. Your data collection methods. We're also looking at the laboratory procedures. What was the quality assurance? What was the quality control measures you have in place? All those things are important. And then your statistical analysis. Did you use the correct statistical package? Did you have the correct, did you use intention to treat as per protocol? Are your figures correct? Did you manipulate data or not? Or you have a robust statistical analysis? That's part of reviewing. You now come to results. You are looking, did I actually apply? If I did RCT, did I start with a constant diagram? If I did case control or cohort study, did I start with strobe? And so on and so forth. I believe those diagrams should be the first thing on your results session. It helps you a lot. And then you look at your presentation. Were they actually, did you present them in good tables? Did you use charts, diagrams? Do the figures add up? Very, very important. Your figures must add up. You won't tell us in some tables, your total participants are 120. The other one is 130. The other one is 97. Meaning that there's a problem. And make sure that you are consistent. In the last exam, I remember my candidate saying he gave us a constant diagram and he screened for eligibility he screened 1,065 for eligibility. But down the line, he said 862 people were screened for eligibility. I said, so which one do I take? Which one do I take? So you must make sure you look at your tables again, make sure your figures are consistent. Your interpretation, you have to look at interpretation of the findings. Are they clearly described? Okay, and your analysis, are they thorough and logical? Of course, you go down to ethical consideration, make sure you have approval that covered the period of your investigation. The period you are collecting data must be covered by ethics approval. If your ethical approval is elapsing and you've not finished, go back to ethics committee and ask for extension. They give you an extension. They make sure it's covered. Any data collected outside the approval definitely is null and void. In all research involving human beings, you must adopt the Helsinki declarations, which include the respect for person, non-maleficence, beneficence, and justice. In respect for person, remember you have to get informed consent. And informed consent need to be informed. Make sure they are really informed. There are ingredients that make a research informed consent informed and valid. And they include that the person must have agency. That means must be an adult, having the capacity, mental capacity to agree to whatever you are saying. There must be disclosure. That means you must tell the person all that is involved in this research. There also must be understanding. The person must comprehend and then voluntarily sign. Those are the 4 parameters that make informed consent valid. Then normally if you say there must be no harm, so you check your list to make sure that all these things are applied. And then if there is possibility of research compensation, make sure you also did that. Then you go back to you come to your conclusion, your discussion, conclusion, recommendation. Your discussion, you ensure that you are not just repeating results, but actually discussing the findings of your results. You must highlight the positive or negatives. When you start, remember when you start a research, you don't know the answer. So the answer can be positive or negative. But some people, the answer is negative. They want to doctor their data, this and that. No, it's good to tell us that after all this rigorous and robust investigation, at the end, I found there was no association between A and B. And that's a very good study. There must not be an association. If there must be an association, then there's no need for the research. Okay, so it's important. And then at the end, you now ask yourself, have I contributed to knowledge? What has this my study contributed to the body of knowledge? If there is nothing, that means you've wasted your time, wasted your money all these years, and wasted everybody's time. You must have something you are contributing to knowledge. Especially in these days, people have been saying, fellowship is more than PhD, this and that and that. And they bring the dissertation, you contributed nothing to knowledge. Then you have no local standing to complain. You must make sure there is something you've added to the body of knowledge. And then make sure your conclusion is from your study. Your conclusion is from your study. And recommendation is from your study. You can't finish a study and then your conclusion is from something you did not do. All your conclusion, recommendation must be derivable from the findings of your study. Then finally, you look at the structure and writing quality. The general structure, like I said, did it follow the guideline? Is it, did you use simple grammar? Some people are too good with big grammar, verbose. It's not many of us can understand big grammar, especially if you're reading it in the night. So it's always good to use simple grammar that we can understand. Make sure that your study is something that a 14-year-old can read and understand. And must be coherent. The grammar must be impeccable. Tenses must be in the reported speech. Okay, spelling, be consistent with either American or British, do not mix. Those are things you are doing. Ensure that your text is clear, concise, and error-free. At times, you may not be able to do this. Just with little change, you can employ a language editor, an English editor, and it will help you do this. And then there are even some online tools. Grammarly can help you if you know how to use it. At least it will help you flush out the bad batch or the big ones. And then somebody can help you look at the fine details. But it's always good for us to do this. This particular slide is important. Make sure your general structure is clear, is coherent, the grammar is impeccable, and whatever you did is error-free. Then referencing, another important aspect. Referencing is so important. But of course, some of us don't understand the importance of referencing. I remember I always give this story like when we became residents. Of course, in those days, we don't have so much online materials. In fact, there was none. So all your articles will be, somebody have seen it in a text or in a journal, and then you photocopy. So then they'll photocopy an article for us, or you find an article you have to photocopy. The materials is maybe 4 or 5 pages. Then referencing will take another 3 or 4 or 5 pages. So I'll say, why am I wasting my money for photocopying these? Of course, I won't photocopy those references. For me, they were rubbish. So I'll just photocopy the first few pages and left out the references. Then, as you are increasing in knowledge and skill and wisdom, when it was now time for me to use them, I found that I could not use a single one because there were no references. So references are so important. And luckily, like I say, we adapt the Vancouver. Everybody must go back and read how to make your Vancouver citations. It's very, very important. Starting from index citation, where they must be on superscript. Okay? And then in the reference list, all of them must correspond to the numbers of the superscript you write. And all works must be referenced. If you have words that are not referenced, that might pass for plagiarism. Okay, and make sure your citations are accurate. Some people, I don't know why reason at times think that we don't look at this. Okay,
Give me your intention.
I was looking through a casebook, and I think the candidate had very, very old references. I said, change these references. Let's have new references, not later than earlier than maybe 20. I gave a particular something. This person now went back. What he did was to get references. You have a reference of 2012. You claim 2012 and write 2022. That's what he did in some ways. And of course, you will see references who, in these days of internet, to just click and found such dishonesty. That's something we should not do. Make sure your citations are accurate. Okay. Then, and that concludes the aspect of reviewing and revising your dissertation. Like I say, is something that's systematic and methodical. It's something that you take your time to do. You have to do it yourself. Get your co-peers to help you, a supervisor to help you, and get a peer reviewer to help you. So that at the end of the day, you have an impeccable document. Now, let me go straight to the second one, which is defending your dissertation. And like I always say, this is the easiest part of the bargain. In everything you are doing, defending your dissertation should be the easiest part. Because remember, you are the one that's asked yourself this question, no? And you had all the time in the world to look for the answer and you found the answer. Now you just have to go and tell somebody, see what I did. Then why should you fail why will you fail your defense? If you actually did it, definitely, it's going to be the easiest part. Anybody that fails the defense of this dissertation did not do the work. I'm telling you, didn't do it. Or if he did, he didn't understand what he did. So if you actually worked with a supervisor, when I mean working with a supervisor, I mean working with that strict and probably wicked supervisor that will not allow you time. That will make sure before you move to the next step that he has approved. That wicked supervisor, if you have worked with him, you will never fail your defense. But if you work with that very beautiful, nice, easygoing, understanding supervisor, you may have a problem. You might have a problem. So if you did the work and you wrote up the thesis and reviewed your work, this is the easiest part of the bargain. What do examiners want to know? What do they want to know from you? And these are the things I want you to be thinking of. Was your work actually realistic or relevant? I remember I told you the story of somebody telling me he recruited 80 people accurately matched in 6 months. See, today I don't believe it and will never believe it. So if you do something that I think is not, examiner thing is not realistic, you can't pass. You know, it means you are dishonest. They want to know that you actually did the work and you followed your methodology, you understood what you did, and you contributed to knowledge. It's important. So then they tell you what is the take-home message. There must be a take-home message. The person that wasted his time reading you out from introduction to it must be compensated with a take-home message. What is it? They also want to know, did you actually follow the approved protocol? The research ethics committee approved the protocol for you, and somehow did you follow it or you deviated without getting another approval? We are there major methodological or ethical flaws. Once any of this is detected, you can't pass that defense. Okay? They want to know whether you actually understood basic research principles. And then they ask you what study do you say? We say cross-sectional study. So, okay, tell me what is a cross-sectional study. And you don't know what is a cross-sectional study. How can you not tell us that you've done a cross-sectional study when you don't even understand what cross-sectional study is? Or you did a cohort study, you are telling me about odds ratio. That means you don't even understand the link. So please, you must understand basic research. You must also understand basic ethical principles as well as basic statistics. You say p-value of less than 0.5 is significant. I say, what do you mean by p-value of less than 0.5 being significant? How do we interpret it? And you don't know. Every study has a limitation or limitations. You must know the limitations of your study, starting from the study design, okay? So please, like I said, all aspects of your dissertation, starting from introduction to appendices, can be queried. So you must get prepared for it. So I think I tried to devise a checklist that you might have anytime you want to go for defense. You will have this checklist and ask yourself these questions. Have I provided a concise summary? Before I go for exam, please prepare a 5 minutes and 10 minutes summary. So that when you get to the exam, that's usually the first thing. Give us a 3 minute, or in the next 3 minutes, or in the next 5 minutes, or in the next 10 minutes. You must know how to do this. Has the introduction provided a basis for the study? Was the literature sufficiently reviewed? Is the justification convincing? Is the research question well articulated? Are the objectives smart? Is the study design appropriate? I think we are going to have this slide. So this is a useful checklist that you might, you went through how the typical dissertation. And if you can answer all these questions yourself, you are ready to defend your dissertation. So those are at the end, you can see we are the citations adequate. What were the limitations? Did the conclusion and recommendation draw from the results? What have I contributed to knowledge? We are appropriate appendices attached. So if you look at the checklist in these 3 pages, when you have the slides, they will help you. Whenever I finish your dissertation, you are going for defense, go through them one by one and check the boxes. After that, preparation for publication. You know, if after doing a study or research, I even submit it to the college and it passes, then I don't publish it, it's unethical. Remember, if you do a study, it should contribute to the body of knowledge. And if you hide it in the archives of the colleges, you have not done anybody any good, because somebody will now come and do the job again because it's nowhere in the internet. And again, you are also shooting yourself. You don't have any publication. Oftentimes, as residents or consultants, it's this your cases, your long case, the 2 long cases, your dissertation. Those are your first papers. Those were my first papers. So you must prepare them and publish them in article, and it counts for you forever. Anytime they Google, they see your name. Okay. So for you to prepare for publication, you must understand there's a difference between journal article and your dissertation. You can't just carry your dissertation and now give to a journal publish. No, you must know there's a difference in structure, in length, in the introduction, the way you are supposed to write your methodology, results, everything. They are all different. Okay. So oftentimes, remember your dissertation, oftentimes the word count is like 20,000, 30,000. But you are coming to a journal, they say it's 2,500, some 1,500, some 3,000. So you see, there's a whole lot of different. You really have to summarize a lot of things. Okay. So, but the first thing you do is that you must choose the journal. You must choose a journal. Which journal do I want to publish in? All the journals have different guidelines for the editor, for the authors. And you must. So in choosing the journal, you must be mindful of who we call predator journals. Predator journals. These are journals that they are just waiting for an article. You get your article, they tell you what to pay, you pay, they publish. No peer review whatsoever. You understand? They are not out there to help the science world. They're out there to make money. And then some gullible authors will just, as long as they have the money. Unfortunately, when you bring such papers for promotion or anything, they are disregarded. So please beware of predator journals. Know the scope of the journal. This can be a journal of pediatrics, and you are sending strangulated hernia in adults to that journal. Of course, they say it's outside our scope. So you must know the scope of the journal. Also look at the impact factor of that journal. You want to send your journal to your paper. Journals that have impact factor. Because if you run yourself back into the academic world and want promotion, it's just impact factors that will really grade your article. So not just any article published at there that has no index or nobody knows about. It's almost becomes a futile cycle. So you must look for journals that are rated highly. Journal with robust peer review mechanism. That's what makes a journal have impact factor. Okay. Then you want to know whether it's a journal that is just online or they have print or both. You always, and then the applicable fee. You can't just say you are journal. When they are saying, say, oh, you have to come and pay $2,000, you now start scampering. From day one, you should know this journal, I can afford it, I cannot afford it. Okay? Then remember, read the instructions to the authors, know the structure, know the way they want the article to be done, and then you are within their word counts. Okay? Be mindful of the word counts. Then you can decide on the number of potential articles. One good thing, if you do a thorough job, one dissertation can get you to 3 or 4 articles. In fact, each of your specific objective, if you do them well, can be a standalone article. And then when you are publishing, you say this is a part of a larger study, so that you won't be accused of salami. That's what we call salami slicing. You must say this is a part of a wider study, and you are just looking at each objective becomes, we've done that. We did one big study in this country, had a big publication, but we now took each aspect and had another robust article from it. So you must decide on the number of the articles. You must decide on the authorship. Who is your first author? Who is your second author? Only people that contributed are your authors. There should be no gift, ghost, or guest author. So, and that is what I mean by avoiding publication misconduct. The corresponding author is so important here. The corresponding author, who might be you, or the first author, or maybe any other person, but this corresponding author must know everything about that publication, because the journal will be corresponding with this person. Is this person that say we need revision? The person have to take it up and so on and so forth. Very, very important. Then consider ethical matters. Make sure you have ethical approval. Some journals will look for ethical approval before they publish. Plagiarism check, you cannot overemphasize that. Most journals have plagiarism checkers, and you submit an article, that's the first thing they do. And if you don't meet their standard, they return it for you. And then follow their submission guidelines. And the good thing now is that if you are a resident of the National Postgraduate Medical College, you can publish article from your dissertation free of charge in the National Postgraduate Medical Journal. This decision was taken earlier this year. So if you graduate and you get article from your publication and send to the National Postgraduate Medical Journal, it will publish for you free of charge. So I think with that, all that remains is for me to thank you for sharing your evening with me. This was a short team, and that's the end. Thank you so much to the authorities of ARD, ESUT, to Sister Pauline, the anchor, and all the wonderful audience. Thank you and good evening.
Thank you so much, great Prof. You can see that many hands are just up in thanks and also ready to ask their questions. We can never have anything less than the best from you, Prof, and we are so happy. So having done justice to the 2 topics this evening, reviewing and revising our work and also preparing for defense and publication, it's now time for us to ask our questions, make our comments and clarifications. Remember, those who were not opportune to be in this platform, please, we have our YouTube channel. You can go to that handle and drop your questions and it will be taken. Thank you. Dr. Pami Anoka, please unmute and ask your question. Thank you.
Thank you very much, Pauline. Good evening, Prof. Thank you for the lectures yesterday and today. I have a slight problem, and my problem lies with the fact that I am to do a multiple center study, which includes 3 centers, a primary healthcare center, a secondary healthcare center, and my teaching hospital. And I intended to do, my center has 5 clinic days. And these 5 clinic days, we have 5 units, which forms a cluster. Then I did a pilot study. I went to O.U.J Hospital. They do their booking on 2 days. And then the primary healthcare center, they do their own booking only on Fridays. Now I want to recruit my patients. And my patients that I'm going to recruit will mean that I will randomize them into group A and B. Those carrying male fetal sex and those carrying female fetal sex. But my problem now is after generating my computer numbers that I have about 15 days, I don't know how to fit into the primary health care center that only books on Fridays. And then this secondary health care center that books only on Tuesdays. So that is where I have a problem. I don't know how I will do that, sir. Considering that I wanted to do a multi-stage sampling as well as a cluster sampling. I don't know how I'll go about it, sir. Thank you very much, sir.
Sorry, your question is a bit complicated, but if you are going, because now primary health care center is different from secondary, different from tertiary. Okay,
yes, sir.
So if you're doing a multi-stage, okay, that means your sample from the primary health care center would definitely be independent from now the secondary and different from that of the tertiary. So it doesn't matter how many days you are doing, you calculate the sample you want and know how many you want from each of these centers, and then you independently sample them randomly. That's what I think you should do, because you can't merge all of them together, because it's like a stratified, we are doing a stratified sampling. They're all independent. You can't mix the patients in tertiary center with the patients in secondary center. They must be analyzed individually, and you have to recruit them individually in their own situation. So, but I don't know if I understand the flow, but this is the kind of thing you sit down with a supervisor and iron it out, okay?
Yes, Prof. Thank you very much, sir.
All right. Thank you, Prof. Dr. Nwamaka Obologu.
Thank you, Prof, and good evening. Good evening. You mentioned about salami slicing. Please, can you throw more light on that? Thank you, sir.
Okay, salami slicing is publication misconduct. Okay, now let me give an example. We are in Enugu. I now did a study on infant feeding practices in Enugu. Okay, you just collected one study. You did that. You just have a sample size of maybe 200. You got some from Abakpa, some from MNS, some from O.U.J, and that is supposed to be one article in Enugu. But in now publishing, you now say, oh, infant feeding practicing in Abakpa, one paper. Infant feeding practices in MNA, one paper. Infant feeding, it's the same paper you are circulating, but in different something. Can you say infant feeding practices in Enugu metropolis? The next time is that infant feeding practices in Enugu East local government area. Meanwhile, it's the same study. So that is called salami slicing. When you have one paper and you break them into components that are almost the same, but different titles, in order to confuse people, it's called salami slicing. I hope that's clear.
Yes, Prof. Thank you.
All right. Thank you very much, Prof. I think those were the two hands that were up. I don't know whether any of us still has a question to ask or clarification, and checking.
Yes.
Okay.
I have a question.
Dr. Romeo, please.
So I have a question.
Go ahead,
Hello?
Dr. Romeo. Romeo, go ahead.
Hello?
Dr. Romeo, we can hear you.
Can I ask?
Go ahead, Dr. Mbo. Hello.
Yes. My question, thank you, Prof, for the very lucid presentation. I noticed that the West African College of Surgeons released a guideline that conclusion recommendation should be in chapter 7. There should be another chapter for conclusion and recommendation, and that the justification for the study should be taken to chapter 3, chapter 2, that's under literature review. I just want to know whether there's any explanation for that. Thank you.
Oh, I've sounded that since yesterday, that each institution, each body has their own peculiarities. These guidelines are site-specific. Those are the words I used yesterday. So they don't have to explain to you why they are doing, but that's the way they want their own. They might decide to merge the conclusion, recommendation in one chapter with discussion. They might decide to do it in any chapter. It's their own decision. Yours as the candidate or resident is to strictly obey their guidelines. The reason why they put it that way is not for you to start to discover. Their own is to obey it. Each of them have their reasons. And the thing is that do not confuse the two colleges or wherever you are, other bodies. By the time you are reviewing your study, get the guideline from that college and make sure you followed it strictly. So I don't know the reason why they did that, but if that's the way they want their thing done, so be it. Thank you.
All right. Thank you, Prof. I appreciate.
Yeah, thank you. Dr. Michael, please.
Okay.
Dr. Michael, on mute.
Yeah, okay. I hope you can hear me, Dr. Pauline.
Yes, go ahead, sir.
Good evening, everybody. Good evening, Prof. Thank you for your presentation. What should be the component of a 5-minute summary, 10-minute summary, or even a 5-sentence summary? Thank you very much.
Okay, I think that is the question for you to answer because you did this job. You want the examiners want to know everything you've done in 5 minutes. So you should know actually how to package it. But what I always advise, if you've written an abstract, that gives you a very, very good resource for your summary. Okay, that abstract might be what you have to present. But depending on what you don't waste, oftentimes people waste time on the background, start telling us about the quality literature I said about the study. No, always just one sentence, introduce your study, and then the next thing, tell us actually your motivation, the justification, what you did, the results, and the recommendation. That's what we expect to have. So if I say 3 minutes, 5 minutes, 10 minutes, so what you present depends on the amount of time you have, because some examiners will give you time. They tell you in 3 minutes, some tell you in 5 minutes, some tell you in 10 minutes. So that's the practice you have to do on your own. Know how to summarize, bringing out all the key elements of your study in 3 minutes. Knowing how to do that same thing in 5 minutes and how to do that same thing in 10 minutes. Oftentimes, you are not giving up to 10 minutes, usually 3 or 5 minutes. So, but that's what you should know, okay? Thank you.
Thank you very much, sir. I think you really did justice to all of them. I don't know whether any of us do.
Yes, I have a question.
Okay, Dr. Gloria, go ahead.
Thank you so much, Prof. Please, I have a little question. When you talked about maybe the result of your work, you said at the end of the day, it could come out that there was no difference observed. Maybe it was negative, I think. So, but at the end of the day, you're also told to make a contribution to the body of knowledge. So I don't know whereby the results did not show any would I say what you set out to achieve or to find out, it was actually not there. So will it, I don't know, does it invalidate your work? Do you have to now go and start a different thing, or I don't know, what would you do at that point? I mean, when you're supposed to contribute to body of knowledge, that's what, so it's confusing me here.
Thank you for asking that question. And I'm sure that is the problem many people, and that's the source of the error. And that's the source of the, will I say, crime or dishonesty many of us perpetuate. It's when we say contribution to knowledge. If I'm looking at the effects of Panadol on eclamptic fits, you understand? I ask my question, can paracetamol abort eclamptic fits? I now do all the rigorous study, and at the end, I find out that it does not. My conclusion is that paracetamol does not in any way abort an eclamptic fit. That is a contribution to knowledge. It's a big contribution to knowledge. Because he had told somebody, please, when you have eclampsia and somebody is saying Panadol, it won't work. The fact that you now have that knowledge that it won't work is a contribution to knowledge. You understand? So, but some people, when they find out it doesn't work, what do? They start tweaking figures, manipulating, and then say, oh, Panadol, we have bought eclamptic fits. Do you understand what I mean now? So it's still a contribution to knowledge. You contribute to knowledge that, please don't waste our time on this. Don't waste our time with this. It does not work. That's a big contribution to knowledge. I hope I've answered your question.
Yes, Prof. Thank you very much, Prof. Thank you.
Thank you. I don't know whether any other person has any more question. It is now 4:49 p.m. And just as we all know, our Prof is someone that is so time conscious. Integrity and honesty turns him on, so he never missed that time, never missed that 4 p.m. to start off. So if we still have questions, we take. And in the absence of any further questions, we still want to continue to thank you, our dear Prof, for sparing us this your time, despite the busy schedule you run every day. We are so happy that you have really shared your valuable insights and expertise with us. And your knowledge and the experiences, honestly, we shared today provided us and is also providing us with a wealth of information and inspiration to help us in our dissertations as we are battling with such now and about preparing for it. So further this thing, I don't know, we can still read further about research. There's a textbook, a very beautiful one, Research Brief. If you've not gotten it, please let us look for it so that whatever information we've really gotten from Prof within these 2 days, we can build more on it by looking into Research Brief. It is a book that when you and I go for it, I think we might not continue to fear proposal, dissertation, and research. In the absence of any other things, Dr. Gloria, I don't know what you have for Prof. Dr. Gloria, please.
Hello. Yeah. We come to the end of the series with Prof. So, Prof, we want to say thank you very much on behalf of ARD ESUT Parklane for availing us your time. I mean, I know we can't pay for your time, so thank you so much. We really appreciate for giving us, these 2 days. It's not easy. We had to be on you to just bring out this, squeeze it out from your busy schedule. So thank you so much. We really appreciate it.
I appreciate you guys too. I will send my slides over to you so that I can share with people who want it. Thank you for inviting me.
Okay, sir.
Thank you
so
Prof.
much.
Where can we get the book, please? The book is very much available. Let us know. Abakaliki is there. You can also reach us at ESUT Parklane. I think just you can get in touch with me so that we know how to get it across to you, please. Let us know your name.
How do I get in touch with you?
Okay, I'll drop my number is 0. No, I'm in Parklane ESUT, please. We can help you out. 08063289814. Okay.
Oh, so fast.
Okay.
Can you drop it on the page?
Okay. 08063289814. We'll soon end the meeting.
Please, sorry, say again. Sorry.
63289814. Oswago Pauline.
All right, thank you.
We will also connect you with those in Abakaliki so that it will be easier for you to get, okay?
All right.
Thank you, everybody. Just to remind you once again, We have the 6th one next week, 6th webinar series next week. Try to be part of it and come in on time. You know, it's not good for us, those that need something for our lecturer to be waiting for us. I felt a bit, I don't know, uncomfortable when Prof had started and most of us were still coming in. By and large, we thank everybody for being part of this. Thank you, and God bless you. The host.
Thank you, sister. Thank you so much.
Thank you, Chief dear. Yeah.